From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Many U.S. health officials are concerned by 53 confirmed human cases of a bird flu variant across 7 states this year. And there is now a new potential case in a California child without known contact with an infected animal. And don't forget, a Canadian teenager is still fighting for their life in critical condition at a British Columbia hospital after contracting the bird flu. So, how concerned do we need to be that we may see another pandemic? Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak, is joining us now to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, I have to say, I find this highly concerning, in particular with this case in Canada and now, this potential new case in California. So can you tell us really about the magnitude of this spread? I mean, in particular among birds and cattle, and really not being able to, at least it seems to me, not being able or willing to contain that spread.
Well, you're precisely correct, Gemma. So the things that worry us about that are some of the lessons that your listeners have learned from our conversations over the past 4 years when talking about other viruses, and especially SARS-CoV-2. And that is, the more opportunities you give the virus to replicate, the more mutations that will occur. And we've seen this play out for the last 4.5 years. And influenza is even more susceptible to this kind of thing, and a very dramatic change that we call reassortment. And that is because if you think about the genetic material of an influenza virus, it's got 8 big pieces, essentially. And it will swap those whole pieces, not just one little point in the genetic material like we were early on seeing with SARS-CoV-2, but a whole chunk. And it can swap it with another completely different influenza virus. And then the product is something that may be very different in terms of virulence, transmission, and so forth. And of several pandemics that we've had in the past, it's because these reassortment events have occurred when an avian influenza virus, a bird flu virus, infected a pig, and a human virus did. And guess what? We're coming up on human flu season. So this is going to be a really bad time. And then the second point that you made, because we have watched avian influenza for decades, but we've never seen an avian influenza outbreak before that couldn't be controlled and spread so widely as this has over the past 2 years. And so the very point you've made, the fact that we haven't been able to contain this, very, very concerning.
So, Dr. Pate, let's talk a little bit more about this teenager in British Columbia. I mean, we're not sure if it's a boy or a girl, but this teen was healthy. They are now critically ill. They are in critical care. I mean, we're talking ICU. And we do know that the infection came from a bird, correct?
That's correct. Because we got the genetic material back.
Okay. Right. So how concerning is this, Dr. Pate? I mean, I have 2 teenagers. This concerns me greatly. And I know it's, some people may say, oh, it's just one case. Well, I think we need to be a little concerned when there's just one case.
You do. And the reason is, look, I don't know if this is going to turn into an epidemic or a pandemic or not. But what I can tell you is that since you and I have been talking about this from March, 8 months ago, I have only become progressively more concerned because of all the things these little things that we're seeing, and realize, just like with COVID, you don't realize you have a pandemic until you have it, and it's spreading. And by that time, it's really hard to contain it. This is exactly the time that we should be pulling out all the stops to try to contain the spread of this virus. And you're right, that teenager, I expected to hear that the teenager did have contact, was working on a farm or something, and maybe did have an immunocompromising or chronic health problem. But this was a healthy child, and we still don't know how the child was infected, although there is a intriguing coincidence that the pet dog was apparently extremely ill at the time that this child became sick. And although we have not ever known of a case where it transmitted from a dog to the human, and we do know it's that virus. If the dog did play a role, it was from a cackling goose. Somehow the dog got in a connection with that, so we can tell where it came from. But the additional concerning things is not only just how ill this healthy teenager is with acute respiratory distress syndrome on a ventilator in the hospital for 2 weeks now, but also the fact that we've seen 3 troublesome mutations in the virus that are mutations that would ordinarily help the virus spread better in humans. And while some of those can occur after the human is infected, and we saw this in the Texas farmer that got infected, 2 of the mutations this child has are really difficult mutations, and it's very unlikely, since we think he was just exposed 3 weeks ago, that would have given time for this to have happened. So that increases our concern that some of these mutations may be occurring in the animals out there, and that is worse news, as well as the fact that we also now have just identified in some British Columbia birds that they also have a mutation that is making the virus less responsive to our main antiviral treatment.
Okay, so a couple of questions here. What about this then spreading or transmitting more efficiently from animals to humans? And I mean, what are your thoughts on that and what's going on?
Well, it's concerning. First of all, up to this point, we know the virus is not spreading efficiently to humans from animals. In other words, from what we know, it has required a rather protracted exposure to the animal for the person to become infected. However, so that's on the good news side. On the bad news side is that when the CDC conducted a serologic testing, that means testing for the antibodies of farmers, what we found is that 7% of the farmers had evidence that they had previously been infected. So the spread has been much more than what we thought. And of course, those were mild cases not recognized. But that shouldn't lure us into a false sense of complacency, because it won't be that particular form of the virus that causes a pandemic if one does occur. It will be this new reassorted virus. And I think it's just problematic, and it shows us that all the pieces are getting set up. Now, if those pieces all converge at the right time in the right place, yes, we could have a pandemic. That's still it's going to take quite a number of changes, but we are entering into a high risk time with the flu season. And so that is going to become more likely. And again, we shouldn't wait till we see evidence of this to try to prevent this, because a avian influenza pandemic will make the COVID pandemic look like it was nothing. This will be far more severe.
So, Dr. Pate, I'm thinking back to the H1N1, and this was, I think, around 2008, 2009. And there was this federal push to get, young children, babies, toddlers, vaccinated. We've talked about this. I remember getting my oldest vaccinated for this. He was a toddler. Why is something like that not going on right now?
Well, and what we need to be doing is preparing. We do have some avian influenza vaccines in our strategic stockpiles.
Mhm.
But if this were to become a full-fledged pandemic, we don't have near enough, and it will take a long time. These are not mRNA vaccines. These are the kind of vaccines predominantly made by eggs, and we would be talking about a quite a long time to ramp up with vaccines if needed. And of course, this comes at a time when we think the new administration is not going to be particularly pushing vaccines, vaccine research, vaccine development, and probably not even taking some of the steps to prepare for a potential pandemic that need to be taken regardless of whether avian influenza is going to become a pandemic or not, because we saw what happened back in 2020. People probably have forgotten, but you might remember seeing the pictures of nurses wearing garbage bags
Mhm.
for personal protective equipment because we didn't have the supplies. There were times we didn't have enough IV fluids. There were times we had many different shortages, and you and I talked about those on your show over the years. So we need to be preparing regardless. There would be a vaccine, but not enough, and it would take a long time. And there are antivirals, but like I said, we may already be seeing evidence that there could be developing resistance or decreased response to our main one. So we need to be developing more antivirals to be at the get-go. And the reason we are concerned about kids is that, frankly, even though we haven't been exposed to this particular virus before, those of us that are older may have been exposed to parts of the virus that would have enough similarity that it would give us some protection. And there's some evidence too that just came out that we could even use the seasonal flu shot to give us protection for a little while until we could develop a specific vaccine. But the kids are going to be the ones that have not had any pre-existing exposure, and that's why we see children like this teenager become so ill. And that's what we saw with the 1918, 1919 influenza
Right.
pandemic. It wasn't the elderly, it was young adults in the prime of their life, and they were getting very seriously ill.
Next thing I do want to talk about, Dr. Pate, is the incoming Trump administration and what we have seen so far for who he is nominating for things like the NIH for and he is now he wants Dr. Oz to run Medicare and Medicaid. He wants Robert Kennedy Jr. to head up basically our entire health system. With that said, can you talk a little bit about, why we might be seeing folks who are frankly okay with these picks, in particular, RFK Jr. and really just the peddling that he has done about misinformation around things like vaccines, around infectious disease research?
Yeah. So, there is certainly a lack of trust
Mhm.
in science right now. And this movement towards anti science is not brand new. That has been going on for a while and certainly can trace it back at least to the 1980s. But for all kinds of reasons. But what we are seeing is unprecedented disinformation and a lot of people not knowing who to trust for information. And frankly, people on the side that promote the disinformation are much better funded today. Their messages are much better coordinated, and they are making very effective use of cable network news, social media, podcasts, other things to spread a lot of disinformation to people who either want to believe that, and so it's music to their ears, or that are being deceived and tricked into it. And they're they sound legitimate. They've got a number of doctors. You take Dr. Oz. Dr. Oz was very well trained, an outstanding surgeon, but yet he has embraced promotion of things that actually knows he has gone overboard and that they're not necessarily true. And that was a subject of a discussion with the Congress. But that it generates followers, it generates revenues, it generates fame. There's any number of reasons that people are doing this, but when you now put them at the head of our public health organizations, this is a particular threat. And if you think that I'm exaggerating, just go back to when President Trump gave the famous press conference where he discussed getting bleach inside of the body to kill the virus. Look at how many 911 calls there were across the country for people that took bleach and got into medical distress. People think that these people are telling them the truth. And even here we are 4.5 years later, the evidence is crystal clear that ivermectin didn't work, and yet some of these are still promoting that. And the hydroxychloroquine, which Dr. Oz still promotes, actually has been shown to cause harm. And so that's where we're at, and this is a dangerous place.
And Dr. Pate, can we talk a little bit about one of the things that RFK Jr. is promoting if he is placed in this position? And that is he wants to take a pause on infectious disease research. This is stunning.
Very concerning, yes.
Can you talk a little bit about, in particular, Dr. Pate, I believe it's RFK Jr., right, who has said that polio is not caused by a virus?
Oh, yes. Yeah. And this is very, very, very dangerous. For those listeners who are not old enough to remember this, but who have parents that are still living that if they were children back in the 50s, ask their parents to explain what it was like when parents were terrified about their children getting polio. My mother would explain to me going to the movie theater, and the first part that would come up on the movie theater was these advertisements about showing pictures of people in the iron lungs, and we had there was so much polio, and people were afraid to let their kids go to pools and all. The vaccine became available. People lined up for blocks to get their children vaccinated and protect them. It is caused by a virus. It is a disease that we eliminated from the United States, and yet now we have been seeing some cases you and I talked about last year when an unfortunate young man who was not vaccinated got infected with polio from an international traveler and is now paralyzed. And it's dreadful. We don't want to go back to that. We can debate COVID vaccines, but let's not debate the measles vaccine, the polio vaccine, vaccines that we have such overwhelming evidence that they're safe and how many children's lives they have saved. And so this is very, very dangerous. Yes, we need more research. Yes, we need better vaccines. And so instead of pausing research for the next 8 years, we really need to focus research. How can we make vaccines even more effective? And we're making progress. We shouldn't stop that, as well as research into therapeutics for these things, like antivirals and all. We have to be prepared for the future, and we're not going to be.
Well, and again, Dr. Pate, as we've said on this show, if you choose to not get vaccinated or you choose to not get your child vaccinated, we can agree to disagree on you wanting to do that, but it is still your choice, and you don't have to take that choice away from people who want those vaccines is seems to me to be unconscionable, in particular when we are looking at bird flu and then promoting things like, drink raw milk. And we have bird flu going on right now. So I've got about 2 minutes left with you. And I really do just want your thoughts on this idea of someone who could be leading our health departments pushing an anti-vaccine agenda and potentially not making those vaccines available to people who want them.
Yeah, this is a big concern. And I'm with you, Gemma. If somebody has good information and they decide, I don't want to get vaccinated, I'm fine with that. That should be your choice. What rips at your heart, though, and what distressed so many of our healthcare providers were the people who came in 2021 after the vaccines came out when a family member was critically ill, but they didn't get vaccinated because of all the things they've been told. And now here they are at the hospital, the patient critically ill or perhaps dies, and they realize they were duped. So a firm principle of medicine should be give the patient the best available information and give them the risks, the benefits, and then let them make the decision. When we are providing false information, that's manipulating people to make a decision that we want them to make. That's not right. We need to give people good information. And there are so many things that whoever the next director of Health and Human Services could do. There does need to be a focus on chronic disease. There does need to be a focus on nutrition. There are many, many issues, microplastics, all kinds of things. But we shouldn't go back and lose ground on preventable childhood illnesses. That would be a terrible, terrible consequence.
Right. And very quickly, I think you make a very good point, Dr. Pate, that even with RFK's anti-vax agenda and things like that, he does make good points about our food system and obesity and all these other issues and chronic diseases that we should be looking at. I think we can do both, though.
Exactly. And unfortunately, one of the, I follow the anti-vaxxers for some of their common themes. One of it is the way to destroy public health is from within. And I'm afraid that's what we're seeing. And that would be terrible.
Well, as always, Dr. Pate, really appreciate your perspective, your expertise, and of course, the facts when it comes to our health. Thanks so much for listening to Idaho Matters. Boise State Public Radio and Idaho Matters are members of the NPR network. It's an independent coalition of public media podcasters. You can find more shows in the network wherever you get your podcasts. I'm Gemma Gaudette. We'll see you tomorrow.
No matter what happens in Washington, the NPR Politics Podcast is here for you. For the latest news, insights, and analysis from the election and beyond, listen to the NPR Politics Podcast.